Are you in the process of your transition and are looking forward to a breast implant surgery? Then this video may be important for you. In this video, I discuss breast augmentation for transgenders. I am Dr. Shilpi Bhadani. I am a plastic and aesthetic surgeon at SB Aesthetics, Gurugram, India. So when we talk about the timing of breast augmentation surgery for transgenders, generally it is the first surgery that they opt for in their transition journey, and rightly so, because this surgery actually gives a change from a masculine to a feminine silhouette, which definitely one is looking forward to in their transition. And the profound change that happens with this surgery, it definitely adds to their confidence as a female. So obviously, when we talk about timing, an important role comes of the hormonal treatment. So if you opt for this surgery early on, then you are yet to see some breast growth from the result of your hormone treatment. And if you are taking hormone treatment for some time, then you may have seen some breast growth. In both the cases, breast implant augmentation will definitely give you the desired fullness that you are looking for. Now, in some cases, after the estrogen has been started in the transition and you've taken it for a few years, you may see a sizable breast growth. And in those cases, sometimes even fat transfer is a good option for augmentation. So if you have good fat reserve, then definitely we can do some augmentation on the breast that they have developed after the estrogen therapy, and definitely you can have a pleasing result out of fat transfer too. But it really depends on how much of breast growth you've seen. So obviously, for the right reasons, breast implant surgery is definitely the favored surgery over here, because with fat transfer there are limitations, that there is fat loss after a few months, and then you feel disappointed after a certain time that the result that you're looking for, you did not get enough of that result with fat transfer. So definitely the result with breast implant far outweigh the result that one gets with a fat transfer. So now comes the question of approaches to having breast implants. So obviously many times trans women will come and ask us that if we prefer the axillary approach or the intramammary approach. Now when we are doing augmentation from the axillary approach, there are certain limitations that one must understand, because when we are putting the implants from the side of the arm or from the axilla, then what happens that the implant placement tends to be slightly outward and lateral, and the gap in the cleavage is generally a little wider. So my choice of putting the implants is definitely intramammary. With intramammary approach, the scars are hidden, and once with the implants, when the fall of the breast comes, then definitely these scars become all the more hidden, and the scars over a period of time become literally not noticeable. So obviously, when we are talking about the different approaches, we must compare the results that we get from a trans axillary versus an intramammary. So the limitations of trans axillary, in my opinion, is lateral implant placement or outward implant placement. Then there is also the question of animation. So basically, when we are putting the implants under the muscle, then the movement of the muscles tend to shift the implants more laterally when the arm or the chest moves. So obviously the result is not as pleasing, in my opinion, as with an intramammary approach. So my choice is definitely intramammary approach, so that we don't have the limitation of the transaxillary results. Now we've also revised a few cases who've done a transaxillary augmentation earlier and they're not pleased with the results because the implants are too far out laterally or too high up actually. So then in those cases I've gone in with an intramammary approach, and then I have shifted the implant down into a better position or changed the implants. So definitely I would say that for me trans axillary has limitations, and intramammary approach definitely outweighs the benefits when we compare the both. Also, another important point to consider is that if your scars don't form well, then the axillary scar is much more visible than the intramammary scar. So now comes the important question of size selection. So for a given breast base, so we're not talking about trans women only here, or in general in breast augmentation, what we do is that we take the breast base diameter, and according to that we have a few options that we can select depending on how big or how natural you want your result to be. So obviously it's not just one size, but 2 or 3 sizes that we can offer for a particular breast base. Now again, if you want a very good cleavage, then you may want a bigger implant. In the transgender population, generally we see that the shoulders are broad and generally the breast bases are broad. So obviously when we are comparing with other women, the trans women generally they usually would have a slightly higher size requirement than the normal population. So obviously the result will depend on the size, and if you want to go big or very big for that matter, then you may have to opt for a two-stage procedure, because of course there's limitation to which we can expand the breast skin in one go. So my advice is that if you want to go very big, then you have to start with a moderately big size implant, and then you can definitely change a couple of years down the line, or a few months even down the line, you can change to a bigger breast size. So definitely breast implant is one of the most important surgeries when we are talking about transitioning from male to female. There's another approach that we follow sometimes, is that a person who's had breast implants and is undergoing a body contouring surgery, then you can definitely have some fat transferred into the breast to gain a little more volume or a better cleavage. So that is always an option. So if you found this video useful, do like and share, and do subscribe to our channel for more informative videos. And we are coming up with very interesting content. We already have a lot of content on our channel. So do subscribe and keep the notification bell on.